As a healthcare facility administrator, two of your top goals are excellent patient care and safety every day. At MedEyes, we understand how challenging it is to provide quality care while controlling your operating costs. That's why we've developed the Angel Series, a robust, scalable information platform that can help you reduce infection rates, detect patient falls, and track important assets across your facility, all with a single system that's cost-effective for a solid return on your investment. The MedEyes patented warning and reporting system uses an underfloor antenna matrix that can be installed in conjunction with a wide range of Forbo flooring products, including environmentally friendly marmoleum in both sheet and tile format. Other products in the Forbo collection that complement the MedEyes Angel system include Flotex, a flocked resilient sheet and tile flooring, Eternal sheet vinyl, and Coral entry systems. Whatever flooring system you choose, the MedEyes Angel system keeps a constant vigil over patients, staff compliance, assets, and top-to-bottom efficiency. Let's see how the MedEyes system performs in a real-world setting. We'll see a high-level demonstration of integrated hygiene monitoring, fall prevention, fall detection, and asset tracking systems. Then we'll take a look at each component in more detail. The nurse enters the patient's room. MedEyes detects her presence, greets her, and reminds her to wash her hands. The easily readable monitor gives her important information about the patient she's attending, including special precautions she needs to take. If there are no special procedures required, the green indicator tells her she should follow standard hygiene protocols. As you know, hospital-acquired infections, or HAIs, are the leading cause of accidental death in the United States, with more than 90,000 fatalities each year. Current practices of training and recommendations about hygiene are necessary but insufficient. Actual tracking is the only way to generate effective metrics and establish satisfactory compliance. The MedEyes system knows if the staff member has forgotten to wash her hands, with a warning that reminds her. When she takes soap from the integrated dispenser, the MedEyes system verifies that she is following the proper protocol and records the action in its database.
Good morning, Mr. Smith. I'm your nurse, Pam. How are you today?
Okay, I'm doing a little better.
MedEyes observes, reminds, tracks compliance, and generates reports, all automatically. That means administrators can evaluate, analyze, and improve hygiene behaviors more efficiently, freeing doctors, nurses, and other healthcare workers to focus on safe patient care. When the nurse enters and leaves the room, the MedEyes system records the time. This tracking feature gives administrators precise, detailed information about employee resources and allocations, so administrators can make more effective decisions in real time. Sometimes patients have unexpected side effects from medications they've been given, occasionally overestimating their physical abilities. This patient wakes up with an urgent need to use the restroom. He thinks he's just groggy from sleep and ignores the warning signs that something's not right. While Mr. Smith may not be fully aware of what's happening to him, the MedEyes ground proximity system is watching. Force of impact monitors, or help buttons, won't detect every fall. In this case, the patient has fallen slowly and is disoriented. Fortunately for him, he's in a MedEyes instrumented facility. The antenna system under the flooring material detects that his wristband has been in proximity to the ground too long, indicating a near-floor event. An alarm appears on the monitors in the patient's room and at the nurse's station. Our smart notification technology immediately identifies the staff member who is closest to the patient's room and alerts them. MedEyes is fine-tuned to minimize false alarms and prevent alarm fatigue, so staff know the need is most likely a real one, and the MedEyes system keeps watching and will alert the next closest staff member if the first doesn't respond within a time deemed safe by your facility. When the nurse arrives, the system recognizes his or her credentials automatically. As soon as the nurse determines that the patient is conscious and breathing, she helps him into a safe position, then uses the MedEyes wall monitor to alert the nearest physician on duty who gets the message almost instantaneously. And again, when the doctor enters Mr. Smith's room, the system logs his presence and expects him to wash his hands. And when he uses the MedEyes soap dispenser, the system records his compliance as well, all without requiring extra interactions or steps that may be low priorities in an emergency situation. The patient is fortunate. The doctor determines that his fall wasn't serious and was probably caused by a side effect from the pain medication he received earlier. But to be safe, the doctor orders additional tests. He asks the nurse to notify the radiology department and find a wheelchair to transport the patient. Again, MedEye's smart technology saves time and effort. The nurse uses the monitor in the patient's room to access the system's asset tracking application and find the nearest available wheelchair. Some systems are accurate to plus or minus 30 feet, prompting a search in multiple rooms or even on different floors. But the MedEyes system gives you 99% room-level accuracy. In this case, MedEyes finds a wheelchair just 20 feet away. The nurse quickly retrieves the equipment and returns to Mr. Smith's room, washing her hands again as directed before helping the patient into the wheelchair. While the patient is undergoing his tests, the nurse prepares a MedEyes ankle bracelet and updates his status to indicate that he's at an elevated risk for falls. When the next shift nurse comes on duty, she'll see an orange indicator on the monitor in his room that lets her know he needs help getting out of bed. And when she's not in the room, the MedEyes system will monitor Mr. Smith's ankle bracelet for its proximity to the floor, instantly alerting the staff before another accident can happen. MedEyes and Forbo Flooring Systems, protecting your patients, your productivity, and profits. The Construction Management Division of Forbo Flooring Systems and Forbo certified installers work closely with MedEyes technical staff to provide a smooth, efficient, and integrated installation of your Angel system with a single point of contact. Forbo and MedEyes together, improving patient care and operational efficiency.